Hello and welcome. Hello and welcome to the Food Systems Solution webinar series. Today's session is co-organized by the UN Food Systems Coordination Hub, EAT, and the Coalition of Action on Healthy Diets from Sustainable Food Systems. My name is Abigail Smith, and I'm a team member of the UN Food Systems Coordination Hub here in FAO. As everybody gets settled into the room today, I'm going to go over a few housekeeping rules for us just so everybody knows what's going on. First and foremost, today's session will be recorded. This recording will be shared widely, made available on YouTube and the Hub's website. You'll be informed when it's live so you can share further with your colleagues. Next, you'll notice that the chat function is not enabled for participants, but we will be putting links and other information into that chat, so please keep an eye on it. What we have enabled for our participants today is the Q&A section. We highly encourage you to use this. We'll answer some of your questions directly in the chat, and at the end of the session, we'll take some directly on the floor. Last, I ask that you rename yourself on Zoom to include your country or organization, followed by your name. This will help us easily identify you. We have a great panelist with us today and a lot to get to. So it's my pleasure now to hand the floor to the UN Food System Coordination Hub Deputy Director, Lena Seville. Lena, the floor is yours.
Thank you very much, Abigail, and it's a pleasure to be here with all of you this afternoon. Good morning, good evening to people joining from all around the world, national convener, UN agency partners, and other stakeholders interested or working on food systems. Welcome to this UN Food Systems webinar, which we are organizing today with great pleasure and with a very, very interesting panel of participants. The purpose of these webinars is really to foster broader engagement on critical issues related to food systems transformation, and indeed serve as a platform to increase public awareness about various food systems related topics. This is the webinar we're doing shortly after we all convened in Addis Ababa, and I see some familiar faces here. For the UN Food Systems Stocktaking #2, UNFSS +4, which happened in July this year. So since then, we have done a lot of work, and there have been a number of other important engagements around food systems. But now we're convening again online to be able to continue this discussion. This Food System Solutions webinar series is a platform open for the public, and we really hope to have a lot of interesting conversations with you all today. We know that hunger and malnutrition continue to be great concerns. We heard in the launch of the SOFI report in Addis this year that there are still alarming figures of hunger and malnutrition around the world, but we also know that we're operating within the constraints of planetary limits and boundaries. So what we are going to do today is to be able to discuss how to have a healthy diet, but still remain within planetary boundaries and ensure a justice perspective. And we'll be able to draw on the latest recommendations from the 2025 EAT-Lancet Commission report, which was just launched last week in Stockholm, Sweden. I had the great pleasure of being there and accompanying the launch. And really hearing some good and interesting ideas on how to tackle these critical issues. So we'll be able to hear the recommendations from the EAT-Lancet Commission, and I thank very much the participants from joining for this. But we'll also be able to discuss with representatives from different countries on how this applies to their particular context. So we will hear some practical country experiences with policymakers ahead of also what's happening in the Committee on Food Security in a couple of weeks. So let's continue working together across systems and sectors and with all actors that are needed to really ensure that our food systems can become healthier, more just, and more sustainable for current and future generations. It's a pleasure to be here. I want to now pass the floor to Ms. Nancy Aburto, the Deputy Director of the Food and Nutrition Division, FAO, who will also give some opening remarks. Thank you.
Thank you so much, Lena. Distinguished guests, colleagues, partners, good afternoon, good morning, good evening. I know you're joining us from all around the world. It's Truly a pleasure for me to be here today and have the honor of providing a few opening remarks on behalf of the Coalition of Action on Healthy Diets from Sustainable Food Systems for Children and All. It's a mouthful, but it's worth it, and I'll come back to that title in a few minutes. But first, I want to thank our co-host from the UN Food Systems Coordination Hub and the EAT Forum for bringing us together today. This is really a great collaboration as the Coalition, the Hub, and EAT. We all appreciate the need to consider food systems transformation holistically. So I very much like the title of today's event, focusing on healthy diets, on sustainability, and on justice in food systems. So starting with healthy diets, they are undeniably a cornerstone for good nutrition and good health. Diet-related non-communicable diseases like heart disease, diabetes, stroke continue to be the #1 killer worldwide. Whereas undernutrition, driven in large part by poor diets, is still an underlying cause in roughly 50% of all deaths in children under the age of 5. And if we could all practice healthy diets, it could prevent up to 15 million deaths every single year. And healthy diets are also part of that second pillar of today's session, sustainability. Evidence shows that if we indeed were practicing those healthy diets based on context-specific food-based dietary guidelines, we could reduce food-related greenhouse gas emissions by 13%. And if we deliberately integrate sustainability aspects into dietary guidelines, we could triple that greenhouse gas reduction. Meaning that healthy diets have the potential to be a driver not only of healthy people, but also healthy planet. And that brings us to the third pillar of today's session, justice. Because the promise of healthy diets for all, for healthy people and healthy planet can only be achieved if food systems are just. Providing equal and equitable opportunity for decent employment and equitable access and opportunity to practice healthy diets. Justice means the progressive realization of the fundamental human right to adequate food, a universal human right. And justice in food systems also means everyone can realize the right to an adequate standard of living and to just and favorable conditions of work for human dignity, including good health and well-being. So as specialized agencies of the United Nations, the FAO and the WHO have mandates for better health, better food, better nutrition, which are based in human rights. And thus, there is a centrality of justice in all that we do. Therefore, we're pleased to see the emphasis on justice in this recent publication from the EAT-Lancet Commission, and we really congratulate the authors and contributors who have brought this body of work to fruition. And I'm really glad that we have Dr. Fabrice with us, who will present the results of that recent publication. And the discussion that we're going to go into is really quite timely. We're adding thoughts and reflections to this growing momentum and advancing action for that holistic transformation of food systems. Of course, there's the UN Food Systems Summit and its follow-ups, but there's also the 2025 Nutrition for Growth Summit. There's the UNFCCC process that every year continues to integrate more and more action for food systems and nutrition into its advocacy, its awareness raising, its negotiations, just to name a few. So there's a lot for us to build on as we consider this publication from the EAT-Lancet 2.0, and lots of partners to build with. Our coalition, with the Secretariat of FAO, WHO, and UN Nutrition staff, is a coalition of action on healthy diets from sustainable food systems. Healthy diets is our core business. Sustainability of food systems is paramount in our thinking, and we are committed to leaving no one behind. But action is our goal. We're a robust, vibrant coalition, and we keep growing. We now have 40 countries, as well as academic and research organizations, NGOs, and UN agencies involved actively in the coalition. All of our panelists today are from the Healthy Diet from Sustainable Food System Coalition countries. And it is so satisfying to have these country representatives with us to share how they are putting the concepts of holistic food system action for healthy diets, healthy planet, and for the realization of the right to adequate food, decent jobs, and a clean environment all into action. Their examples are also connected to insights shared during a recent study trip to Brazil back in September, which was organized by the coalition in collaboration with UN Nutrition. And I really thank all the colleagues that made that happen. These members that will be speaking today, along with 6 other member countries, participated, really reflecting the coalition's spirit for learning and exchange. So I really thank all of you today that are going to be on the panel for your contributions. I thank you, Dr. Fabrice, for your presentation that we're about to hear, and I really look forward to hearing all of these experiences and sharing with you in your expertise. And I thank you all to the audience for your interest today and your participation. And with that, I think I'll hand it over so we can get it started. Back to you, moderator.
Thank you so much, Nancy, for those reflections, and congratulations on the important work also done by the coalition. So as Nancy highlighted, we will now be inviting Dr. Fabrice de Klerk, who is the EAT Chief Science Officer, to make a presentation on the 2025 EAT-Lancet recommendations for healthy, sustainable, and just food systems. Congratulations also to you, Fabrice, for the successful event organized in Stockholm last week. And I now hand you the floor to share these findings with the audience. Thank you.
Thanks, Lena. Thanks, Nancy. It's a pleasure to be with all of you today. And really, I think it wouldn't be an understatement if I didn't say that the work that the Hub is doing with partners in countries to try to work towards national food system pathways really is, I think, our biggest opportunity to address these 3 goals of health, sustainability, and justice. So we're here with you to push on that goal, support you, and really to see if we can make progress on that challenge. So the EAT-Lancet Commission was a group of 24 commissioners, 10 postdocs, and 70 authors total, who had as an objective to see whether we could describe and provide guidance on healthy foods accessible to all, produced, processed, distributed, and consumed fairly within planetary boundaries. And the justice dimensions really cut across these between these 3 objectives: accessible to all, processed, distributed, and consumed fairly, and then within planetary boundaries, all core elements of what we see as justice. The main piece of work for the Commission is seeing whether we can provide 3 independent normative guardrails to support food system actors in driving that change. Can we describe what is a healthy diet based on the best available evidence? Second, can we describe the food system share of the planetary boundaries to set targets, environmental targets for food system actors? And then third, for the first time ever, we would argue, provide social foundations that allow us to measure progress and understand current status on justice within food systems. And I'll go over the 3 of these in today's presentation. Let's start with healthy diets. We published the EAT-Lancet Commission on the Planetary Health Diet in 2019. And I think the good news for those of you who recognize this plate is that when we look at the new and existing evidence, is that evidence is even stronger than before, that we understand what is a healthy reference diet. We understand that it is about 50% of our plates covered in fruits and vegetables, about 30% of our plates covered in whole grains, whether this is corn, maize, wheat, or teff, or enset, or millet, or sorghum, does not matter. Greater contributions from the plant-based proteins, whether it's nuts and legumes, and more moderate consumption of animal source proteins. When we look at this in quantitative terms, here is the reference diet that we published in 2025. The numbers have not fundamentally changed from 2019. And we think it's important to remind countries and partners that in these times of tremendous change, that the evidence on what is healthy have remained quite stable. This also recognizes the need to translate these foods into metrics that are easier for consumers to understand. We're talking about 5 servings per day of vegetables and fruits. We're talking about 1 to 2 servings per day of nuts and 2 to 3 servings per day of legumes. In each of these foods, we provide the mean value that's often useful for our modeling community, but would emphasize the ranges of values, 200 to 600 grams per day for vegetables, to 130 grams per day for fruits, the ranges that provide that flexibility and choice across foods. We also want to emphasize that this is about flexibility and choice. Whether that vegetable is broccoli, bok choy, chaya, sukuma wiki, baobab leaves or others really is not the key challenge that we're confronted with, but rather ensuring that this food group is represented as part of a whole of plate. So an invitation for individuals and communities to celebrate their own cultures, and also an invitation to celebrate the cultures of others. For the animal source proteins, we want to recognize that we do have zero values that are possible for all the animal source foods. That is, there's good evidence that someone or individuals can be vegan, they can be vegetarian, and they can be healthy so long as they ensure they get sufficient plant-based proteins into their diets. But we also want to signal that there's ample scope for flexitarian diets that include animal source foods. Here, the recommendation is about 2 servings of poultry per week, 1 serving of red meat per week, the ubiquitous hamburger being a great reference for people who want, and for eggs, approximately 2 eggs per week. For fish, the recommendation is 0 to 700 grams per week, another food whose consumption can increase while contributing to healthy diets. The last piece that we want to emphasize in providing this reference diet, and I hope that you are able to look up the numbers in the Lancet Commission and use them as part of your national planning or other work on food system transitions. But we want to remind people that often some of the best examples of the planetary health diet come from the Mediterranean region, North Africa, India, South and Southeast Asia. So many of these references are actually quite close in many cultures, and some countries, I think, have actually relatively small distance to play in terms of maintaining, celebrating, or elevating those foods, providing examples for other countries which may have a longer way to go. We do want to emphasize deep concerns both about pervasive malnutrition and hunger, the weaponization of food by some countries, and a concern that these numbers of hungry and malnourished continue to increase after decades of decline. Similarly, we notice that many countries have significant challenges with unhealthy overconsumption, and there's equal challenge here to bring diets back within healthy ranges in order to achieve their full impact on health. I'd like everyone to repeat after me. The reference diet that was provided here is based purely on health outcomes, not environmental outcomes. This is the biggest misconception from the first commission, and I hope that it doesn't become a similar misconception for the second one. If we were able to shift towards healthy diets, we would be able to avert 15 million premature deaths per year. Again, what we want to emphasize that this is an invitation to explore, enjoy, celebrate our own culture while exploring and getting to know the cultures of others. There are examples of healthy diets that cut across all cultures and regions. And I think that this really emphasizes to us that considering the significant challenge we're confronted with and considering the impact of diet on environment, which I'll come to in a second, what better solution than food in order to achieve this? Foods that are diverse, foods that represent our cultural heritages, and foods that nourish both ourselves, our families, and the planet. Let me go into the second clear normative guardrails that we wanted to provide, and this is the planetary boundaries. I won't go over all of these numbers, but for the first time ever, what we did was provide food system shares of all of the planetary boundaries, all 9. In the 29 Commission, it was just 5. I'll let you digest these numbers in the Commission, but hope that these provide an adequate reference in order to drive transitions towards food systems that bring us back within planetary boundaries. We did a full assessment of food's impact across all 9 boundaries. As a reminder, we've transgressed 7 of the 9 planetary boundaries, but the ocean acidification one was declared as transgressed a couple of weeks ago at the UN General Assembly. When we evaluate the food system share planetary boundaries, what we find is that the food system is the single most important driver of planetary boundary transgression. If we discount transportation of food, processing of food, food is about 30% of greenhouse gas emissions. It's about 80% of biodiversity loss and biosphere change. It's about 30% of land occupancy. It's about 80% of fresh water change. It is about 70 to 80% of the modification of biochemical flows. This is pollution by nitrogen and phosphorus, and about 25% of ocean acidification. For the novel entities boundary, here we included biocides such as pesticides and antibiotics, and we find that food systems have a significant impact on the novel entities boundaries. So here we're highly concerned about these impacts, but the good news being that when we look at changes in how we produce food, what foods we produce, how much we lose in waste, we have significant potential collaborating with food system actors from production to consumption to come back within boundaries. I'll come back to that in just a minute. The third normative guardrails that we provide are guardrails on justice. Here, we use the justice framework that is deeply founded in the human rights literature, using recognitional justice, distributional justice, and representative justice. With this three justices in mind, we flag 4 human rights that we think are essential to be recognized in food systems. First is the right to food, as was called out by Nancy in her opening remarks. Second, the right to a healthy environment. 3, the right to decent work. And finally, 4th, one that transgresses all dimensions of justice, the right to freedom and agency. What we want to emphasize, if you remember my statement earlier that the food system is the single largest driver of planetary boundary transgression, what this reveals to us is that we don't just have the right to food, but we have the responsibility to a healthy diet. For too long, I fear, we framed food as a challenge of ensuring that those who are hungry have access to healthy diets. When we consider the significant impact that food has on climate change, on biodiversity loss, on quality and availability of water, what we would urge this community to recognize is that we not only have that right, but we also have a significant responsibility to ensuring that we transition towards healthy diets. When we look at these measures across the dimensions of social justice, we're deeply concerned that too many people fall below what we would argue is a social foundation, 2.8 billion people who cannot afford a healthy diet, where we need to focus on challenges of access, of poverty, and ensuring that access to healthy diets are available to everyone, everywhere. We're concerned that 5.6 billion people are struggling to have access to food environments that make healthy diets a default option. We're concerned that 5 billion people struggle to live in an environment that's free of toxins and pollutions. The current number for people who struggle to be within a safe climate is 419 million, though we do expect this number to climb significantly over time. I think one of the most alarming findings of the commissions is that when we look at the capacity to be within a safe and just space, that is to the left on the right-hand side of this figure above social foundations, as well as in the bottom part of the figure within or below planetary boundaries, that only about 1% of the global population lives in a condition that we would argue is both safe and just. The emphasis here is really recognizing the food system challenge that we're confronted with needs actions by everyone involved. Those of us who are engaged in unhealthy overconsumption have responsibility to change our consumption patterns back into healthy, both for our individual health as well as in contribution to ensuring a safe environmental space for all. And we absolutely need to increase our efforts to make sure that the 2.7 billion people who are in unsafe and unjust situations are able to make that transition to access healthy diets and safe environments. I want to go into, I think, a more positive part of the Commission's findings, and we hope that our guidelines on healthy, safe, and just, again, provide a North Star that can be used by a diversity of food system actors to drive that change. We did want to explore, well, is this change even possible? What would it cost? What would it take? And what impact might it have? And here, we did a significant modeling effort, including 11 of the world's modeling organizations, including both public as well as university organizations, looking at 4 main levers. The first is what we eat. How do we transition to a healthy diet? The second, what and how do we produce, recognizing new potentials from both intensification as well as transitions towards more regenerative or agroecological approaches. And 3, what do we throw away? How do we curb food loss and waste? And our modeling team added a 4th component, the additional mitigation options that might be available to us. This is what happens if we stay on the current course today. So when we look at challenges, or looking at 2050, considering staying on track, we would need 4% additional land to feed 10 billion people. We would increase our greenhouse gas emissions by 33%. We'd increase our blue water use by 13%, and we'd increase nitrogen phosphorus use by 41%. In all these cases, we blow past the planetary boundaries, depriving billions from access to a healthy and safe environment. If we look at what happens when we move towards an EAT-Lancet diet, and this includes 50% reduction in food loss and waste, as well as improvements in production efficiency, we find very positive news. That is, we would be able to feed 10 billion people by 2050 with 7% less land than that used today. This would be the first time in human history that we feed more people on less land. We'd be able to reduce greenhouse gas emissions from food by 20%. We would be able to reduce the blue water use by about 7%. And while we would not come within the planetary boundary for nitrogen and phosphorus, we'd have significant reductions in pollution from both of those goals, but would require additional efforts, particularly in circularity, in order to come further back within the nitrogen phosphorus boundary. Additional mitigation efforts, which Margarero reminds me would be quite expensive, would allow us to have even further impacts. This would include 14% reduction in land, a 34% reduction in greenhouse gas emissions, and coming back within the planetary boundary for both nitrogen and phosphorus. I think these really are results to celebrate and to work towards. This would require a very different food system than that we use today. We do see agriculture increasing by 8% in order to feed the additional individuals that we would have with us by 2050. But we also see significant reductions, particularly in livestock, by 22% compared to today, including a 33% reduction in ruminant meat. But we also see important opportunities, particularly significant opportunity to increase production, availability of vegetables, fruits, and nuts, increasing by at least 63%. Just so you understand this figure here, the white line is the median value. As a quick reminder that what we did this time around, we moved from Marco Springmann's model in 2019 to 11 models that collaborated to analyze food system trajectories in 2025. So the range of results that you see here are the result of those 11 models. So we do see that there still are areas of significant uncertainty, and we call on the food system modeling community and the food system research community in particular to help continue to work on these kinds of model interventions so that we can collaborate with countries and food system actors to help drive and better understand our options moving forward. I want to conclude with a focus on solutions and transformation. When we look at the need to bend the curve, I think what we want you all to understand is that the need to be able to move away from business as usual, the light dotted line, to bend our curve to back within planetary boundaries, the green dots going back down for most variables, going up for affordability, going down for agricultural land use, going up for legume production. We want you to understand that the urgency and the ambition that is required in order to bend these curves is quite significant. So we recognize the critical need, particularly for countries, to develop food system pathways that integrate across these multiple goals, collaboration between countries to understand what the collective impact is, and also recalling, I think, the previous section on justice, recognizing and having honest conversations on fair shares in the transitions to healthy, safe, and just food systems. We see 4 key types of actions that are critical, and in the report we provide 23 specific solutions. We're thrilled to be collaborating with many of the countries on this call today to produce a summary for and with policymakers, which we'll be publishing at CFS on October 22nd. But the main, I think, messages that we have in this transformation section is the specific need to bundle policies, recognizing context specificity, and the need to ensure that solutions are rooted in local context, based on local needs, adapted to local capabilities, and using local knowledge. Second, the need to build coalitions of diverse actors. Food system change requires engagement from production to consumption, as well as important handshakes to energy, transportation, cities, and other actors who are engaged in transformation. We recognize the need to unlock financial resources, primarily in starting by repurposing those funds that are currently embedded in food systems to ensure that they are being targeted and used to those foods that are currently underconsumed and required to ensure healthy access to all. To repurpose them to recognize that our food producing communities are not just producing food, but they have a capability to produce healthy diets, and they have the unique ability, and no other sector has this capability, to regenerate environmental values, All other sectors can reduce environmental impacts, but food producers are unique in their capacity to store more carbon, create habitat, and improve water quality. It's far time that we recognize this capability. We recognize the need to align across multiple goals. And I think what I would want to emphasize here is the unique capability of food systems to create that alignment between climate, between biodiversity, between justice and health. Third, to attract greater funding and new funding to transformations, and also finally to increase some of that funding to encourage faster and more ambitious action. And finally, fourth set of actions that we wanted to highlight is acting on barriers of transformation. I want to emphasize here that when we did our modeling exercise, we are not finding, for the most part, that there is a technological limitation to moving towards these goals, but rather the key barriers are interactions across different food system actors, lock-ins that are often driven by corporate interest, weak public demand, and really emphasizing the need for strong leadership that cuts across these three objectives: healthy, sustainable, and just. With that, I'd like to conclude and say that, what we as a commission find is that food systems cannot be just without occurring the planetary health diet, is ensuring that the planetary health diet is affordable and accessible to all, and without substantially reducing transgression of planetary boundaries. We also find that justice is necessary to overcome barriers that currently impede transformative change, and therefore that justice is not only an outcome of transformation, but a prerequisite to enabling it. Thanks so much, our FAO host and UN Food System Hub, for inviting us to share with you. And what I think I'd like to emphasize with all of you is that we look forward to working across our diverse communities for action, cutting across chefs, restaurants, food service, consumers, indigenous peoples, food retail manufacturers, to together identifying, having those honest conversations and collaborations to unlock potential and really together, collectively, help drive this change towards healthy, sustainable, and just food systems. Back over to you with the Hub.
Thank you.
Oh, should I just jump in, Lena?
Please, go ahead.
Thank you. First of all, Fabrice, thank you so much. Great to have the presentation. Let me quickly introduce myself. My name is Amanda Harding. I'm the CEO of Convene. I've been working alongside Fabrice and the EAT team, curating the 10 communities for action that you just saw on the screen, including the policymakers community for action as well. And this really takes us into the next part of today's webinar, where we're going to move into more of what I was told. We need to think of this more as a sort of a radio show or a television show. We're getting into dialogue at this point. And we're going to hear from the national policymakers, who I have the honor to actually moderate, who are already working hard to bend the curve that Fabrice was talking about, who are already integrating the scientific evidence, the diversity of knowledge and other evidence, as they progress on healthy, sustainable, and just food systems in their countries and in regions and across regions. But to start with, it's also my pleasure to introduce Lynette Neufeld, who really comes in to really be that interface between science and policy. And this is what Lynette and I talked about just last week in Stockholm, who is connecting global to national, national to global. So Lynette, I'm going to ask you a question first, and then I'm going to introduce the rest of the panelists here. Again, Lynette, what do you think we can do to build, what can we build on, and how can we accelerate progress on healthy, sustainable, and just food systems, where we're trying to mobilize that national, global, national policy science interfaces? I know it's a space that you spend most of your time in.
Thanks very much, Amanda, and thanks for the invitation to be here with you today. I'm going to focus my answer mostly on the healthy side of this question, and that being here in the nutrition division is a little bit logical, but of course coming back and referencing back to those other aspects of what a food system, agri-food systems must deliver. So let me just take a moment to start with the task of scientific inquiry. Scientific inquiry, obviously, is that use of methods to explore and to understand our natural world, building on existing evidence, generating new evidence, and from that, providing recommendations on the variety of topics relevant to policy under that field. As you're all well aware, there are often differences of results in the scientific literature. It's one of the big challenges that we face through that process of scientific inquiry. It's also the richness of the scientific inquiry. It is actually that sometimes tension between results in science that help the fields that we work in grow and our understanding deepen and contextualize as we need it to. But that is exactly one of the critical roles that we play as a normative organization like FAO to support that consolidation, resolution of both the real and the apparent contradictions, because sometimes it's not actually a contradiction, it's just a different use of language across the sectors that we work in. And a lot of what we do is focusing and aiming to drive that forward, and then translating that evidence into specific recommendations around policies and programs and so forth. So healthy diets is a good example of this challenge. There's a myriad of publications and definitions out there of what constitutes a healthy diet. And I don't know about you, but pretty much every day I open the newspaper for a quick skim through the headlines. And most days there's something about a superfood, a super diet that will save us and sometimes also save the planet. The media loves this topic. Clearly, that implies that so does the population love this topic. It's an important topic for all of us. Unfortunately, what we hear in the media isn't always grounded in evidence. And even where we're looking at evidence, it's not always consistent in the definitions and the implications. And coming back again, sometimes that relates to the language that we use and the perspectives that we bring together. Today, we heard from EAT, this update from several years ago now, which really brings together a vast amount of evidence across health, sustainability, justice aspects as they relate to agri-food systems and the transformation of agri-food systems. There's a lot that we could discuss and debate there, and just thinking about those implications going forward. But my question is going to focus in on this science policy interface. And so I want to really highlight two aspects of that and provide an example related to that. So coming to our role at FAO as a normative organization, in this particularly related to this, addressing the inconsistencies in the scientific evidence, last year, together with WHO, we published a joint statement on the principles of a healthy diet. And healthy diets are nutrient adequate, they're diverse in foods that are consumed, they're balanced in dietary energy and its sources, and they're moderate in the consumption of foods and nutrients that can pose health risks. Those principles are universal, they're based on human biology, and they're grounded in the scientific evidence. But what we eat is deeply local, based on food access, preferences, tastes, cultures, traditions, religion, other factors. Countries, therefore, develop their local dietary guidelines that ground those four principles in the local realities. And FAO will launch next year a new methodology that for the development of dietary guidelines, which brings in environmental and socioeconomic considerations into that process. And there is an opportunity for us to further dialogue with EAT related to the ways in which that can happen. So that's that first process of sort of how we bring in the evidence. We bring in the evidence through that process that takes place in multiple stages in this regard. So with this methodology and the body of ongoing related work, we aim to advance the utilization of this methodology to inform actions across food systems transformation that can enable the healthy aspect of diets. It doesn't drop off the sustainability and the agri-food system transformation process. And this is another point that I want to make really clearly here. When we talk about this science policy interface, this isn't a simple, straightforward, linear process. There are multiple interests and areas that come together under food systems. Food systems, agri-food systems must deliver on so many different results: economic contributions, GDP, environmental goals, social equity goals, and of course for my personal interest in the enabling access to healthy diets for all. There will inevitably be trade-offs. There will inevitably trade-offs. And I think this is a really important message that is very consistent with what we heard. The diet, the planetary diet, is based on health and then looking at the implications of the planetary boundaries and ways to work with agri-food systems so that we can work within those boundaries. But there will be trade-offs and challenges in accommodating these multiple goals, and the robust evidence is really vital for understanding and managing those trade-offs. So at that science policy interface, it's not one science, it's the multiple sciences from the multiple disciplines that are implicated that we need to be able to bring in. And secondly, and finally, I want to focus on the policymaking side. So that from the science side. Now on the policy side. Evidence is a critical input into policymaking. But from my many years of being a program evaluator and working at that interface, it is not the only input that goes into policy. There are many other interests that come into that process of policymaking, both from sectors, from different groups, from different actors. And one of the ways that we see that can really enable that process to move forward, despite the fact that those different actors and sectors may bring differences of perspective to that policymaking process, and ways in which, and the level of comfort that they have with that embedding science varies. But doing these processes collaboratively from the outset is fundamental. Engagement, dialogue. And that, for example, is a really fundamental part of this new methodology that we are developing for food-based dietary guidelines. It is a collaborative process with the implicated sectors from the outset. And just to take that forward, we want those dietary guidelines used to inform what is needed in food systems transformation. But that collaborative process, that buy-in across agriculture, trade, and the other sectors that will ultimately inevitably be implicated have to be a part of the dialogue in understanding, developing, and owning those dietary guidelines so that they are comfortable using them, because they say they're mine as much as they are yours. And I think with that, looking forward to hearing from countries. Thanks.
Thank you so much, Lynn. I was going to interrupt you, but found it very hard to do so because, of course, you were talking across to what FAO and the work that you're doing is leading to, but also to what we want to talk to on the panel right now, which is covering how do we actually make this a reality? Where do we actually start to address and understand both the synergies that you were talking about, but also some of those tensions, the interests and the values, and where does dialogue play and collaboration play a role in that? I'm going to quickly introduce the panelists. You know that I will be really strict on you on time. I also want to encourage people that have joined us today to get onto the Q&A and to start putting your questions in. Fabrice, amongst others, will be staying with us to the end of the webinar to be able to answer some of those directly in the Q&A function, as will the panelists, but we'll have a little bit of time afterwards to actually be able to take some of the questions. So I'm going to quickly run down who we have on the panel coming from different countries from around the world. So I'm not sure if everybody gets to see everybody, but anyway, we have Dr. Sise Simano, who we're going to talk to in just a moment, from the Ministry of Health of Ethiopia. Faiz Rasul, Head of Policy and Advocacy at GAIN, sitting in Pakistan with a very long experience working on food systems in Pakistan. Yvonne Mavunga, Director of Programs, the Food and Nutrition Council, working out of the President's Office in Zimbabwe. Savio de Silva Costa, from the Ministry for Social Development, and like all the ministries in Brazil, with a much, much, much longer name than that as well. And it's going to be actually talking to us about that whole of government approach in Brazil, as well as from MDS's point of view. And then finally, Matthews Muro, Deputy Director at the National Food and Nutrition Commission in Zambia. So fantastic to have you all with us. We're going to do 2 rounds of questions. We're going to have to be really sharp in the answers. The first is really to talk to what can we actually build on this idea? We know that we are, particularly in your countries, you are making progress, but what can we build on that will accelerate this progress on healthy, sustainable, and just diets? What are those policy solutions and actions, and how are you addressing the challenges? And then, just as Lynette was talking to and Fabrice gave us what those guardrails look like, what does science actually have to do in any of this anyway? And some of you pushed back with, maybe we've got all the science and now we actually have to do the doing. Feel free to push back on that. Dr. Cisse, can I turn to you to kick off on this with the, as I said, what can we build on that will accelerate progress? And what does that mean in terms of from the policy perspective? And does science have any role to play at all? Over to you, Dr. Cisse.
Thank you so much, Amanda. Can you hear me?
We can hear you perfectly, Dr. Cisse. Go ahead.
Great. So thank you so much for giving me this opportunity to share. In terms of the policy solutions and actions that we are doing to address the challenges of healthy, sustainable, and just diet in Ethiopia, I can give a few examples. The first thing is food and nutrition policy, and also the 10 years strategies that we are implementing from 2021 to 2030 that provides overall guidance for the production, consumption of healthy diet in Ethiopia. The second one is the Sakota Declaration, which is the government of Ethiopia 15 years commitment for ending stunting among children under 2 years by 2030, which promotes healthy and sustainable food production, and also consumption among the household level, especially among pregnant and lactating women during the first 1,000 days window of opportunity. The third one is the food-based dietary guideline, which was endorsed in 2022, based on the healthy and sustainable diets guidance, where it provides the dietary recommendations for the Ethiopian population for under 2 years and older for increased diet quality, including diversity and also food safety for optimal health. The food-based dietary guideline also promotes broad food system actions that support diet quality in a sustainable manner. The fourth one, I think as most of you have been here, the food system transformation Ethiopia, which has 24 game-changing solutions clustered in various clusters. Out of those clusters, we have the 2 clusters that really promotes healthy and also sustainable diet by ensuring availability and accessibility of safe and nutritious dense diet, as well as also sustainable and equitable consumption of healthy, safe, and nutritious diets throughout the life cycle. And finally, in terms of the overall policy and also the leadership commitment through our His Excellency Prime Minister Dr. Abiy Ahmed initiative, which we call it the Yelema Turufat initiative, which is a banquet of the basket that improves the national food sufficiency as well as also nutritious, healthy diet production and consumption through the household level, especially the animal origin, where in Ethiopia there is a significant low diet consumption in terms of compared to the plant and animal that fills the nutrient gap through the dairy, egg, and also chicken production. I think in terms of how science could really help in terms of addressing these challenges, I can give some example using Nippon as an example. Nippon conducts a wide range of evidence to inform the policy decision making. In this regard, we have been working closely with Nippon team as a Sakota Declaration also, which has really contributed in the evidence-based policy making. Nippon connects research and policy makers by translating evidence into actionable information for decision making. A good example is when we do the transition for Sakota Declaration from the innovation phase to the expansion phase, the evidence that was being generated from Nippon has really helped us to make a policy decision making. The second part of how science will really help, based on the Nippon example, is the knowledge and information management platform. Nippon currently is serving as a platform for generating, collecting, sharing nutrition-related knowledge and data to inform decision-making processes. It is also helping us in terms of the capacity building, where we are using Nippon to offer training and development, capacity building development opportunities. And the fourth one is Nippon also supports the national initiatives. It provides really crucial information for the major national nutrition program, for the food and nutrition strategy, for the Sakota Declaration, the school feeding, the national food fortification platform. And finally, I think science, as I have said, through Nippon, could really help us to strengthen the monitoring and accountability framework by improving the data visualization and also generating evidence for advocacy, and also generating better data for better policy making. I thank you. Over.
Thank you so much, Dr. Cisse. Thank you for keeping to time as well. But also, I'm just looking at some of the questions coming in, actually quite spontaneously answering some of the questions that I'm seeing in the Q&A. I see somebody's asked, why is collaboration needed? You've talked very strongly to that collaboration between science, multiple levels of government, local and national, but also to what that means in terms of farmers in Ethiopia as well, what that means in terms of consumers and consumers organizations and civil society. So we're already talking to what that collaboration means and what it means to contextualize, to actually look at dietary guidelines, for example, within different cultural contexts within the country. On that, let me turn over though to Faiz. Faiz, do you want to just go ahead? I'm not going to repeat the question. I think everybody knows what it is at this point. Go for it.
Thank you so much, Amanda, and very warm greetings from Pakistan. We used to say an emerging economy, but with huge challenges around food insecurity and malnutrition. 35% population from insecure, almost 85 million of Pakistanis, they are facing food insecurity, and almost 40% of our children, they are facing stunting issue. But over the last 2 years, very important thing is that we have made, Pakistan has made some important strides in institutionalizing food system approach to nutrition and sustainability. So we have recently established 2 key governance mechanisms. This is very important to mention over here. One is the National Steering Committee to overall guide the food system transformation in Pakistan, the overall transformation process, to give the right direction to that based upon what we have already presented and worked out, the food system transformation pathway for Pakistan. And second is the technical working group. This is very strong working group composed of technical people, starting from our federal government, national government, to the provincial government, and going down, to give the insights from right at the grassroots level, to get the insights at the federal level and input into the public policies. So this is how our coordination mechanisms, these are getting stronger, although these are recent development, but it's very strong. And they're actually, these platforms are actually coordination platforms, not generic kind of structures. This is important thing. So there are 3 critical areas what I would like to mention over here. Number 1 is the science and data. So by 2025, Pakistan has started, in fact, we launched quarterly healthy diet costing exercise, very interesting exercise. So this is actually tracking affordability and access gaps in the real time. So, and this complements the food system dashboard, which we have established in country since 2023 and 2024. So it has been a lot of work on that, and also develops an integration with Pakistan food system transformation digital platform. And Pakistan food system digital transformation digital platform is basically a very holistic platform, which give space to food system dashboard as a tool, as a data presentation, data integration and data presentation. And also it gives holistic kind of repository on all the work that different partners are doing across the country. and how they are contributing, and how our food system transformation is being performed in the country. So this is how science moves from research, evidence, data to real policy impact, providing data accountability and direction for the national agenda. Second area, this is national priorities and research alignment. When we worked on our Pakistan food system transformation pathway, we realized that our priorities at the national level to transform food systems are not really that clear. So government of Pakistan is leading that wonderful work. And so how this work is being undertaken, this is very important process. This is an inclusive process to set national food system priorities and align the country's research agenda with policy needs, what kind of needs we do have in country and how the data can help us out to address those needs. So this exercise, obviously led by government of Pakistan, is with strong participation from private sector, academia, and both public and private R&D institutions, is helping everyone get on the same page. So everyone would like to contribute how we are pushing and we are moving towards food system transformation. So in the short, this is in fact building governance, data, and coherence. The third area, which is again policy and action, which is very important for us. And this is how that is giving us a way to move forward. Our focus is on a healthy diet framework co-developed by our public and private stakeholders from provincial level. And this provides a uniform vision for diverse, safe, and affordable diets for all. So,
I'm going to have to interrupt you.
Thank you.
Okay. We're going to come back to you in a moment.
Yeah, I'm just concluding. So this is how these three pillars of our governance, data, and coherence to accelerate progress towards healthy, sustainable, and just food systems. Thank you so much.
Thank you so much, Bayat. I'm sorry that I interrupted you, that you were literally in your last couple of words, and I'm going to really pick up. I'm very grateful for you for talking about this notion of governance, data, and coherence, working across scales, a multi-actor approach. And I think there's a couple of questions. I'm looking at the queue and I'm trying to keep in touch with that as well, which is really saying, how do policymakers actually really meet the challenge of being able to translate science into policy and practice and action? And I think you really talked very practically to actually what is happening at multiple scales with huge ambition in Pakistan on that. Yvonne, let's hear about your experience in Zimbabwe. So straight into that, again, how can you build on and accelerate progress on healthy, sustainable, and just diets? And does science and evidence really have a role to play in that today? Over to you, Yvonne.
Thank you, Amanda. As Zimbabwe, I think we benefited to be part of the Brazil peer-to-peer learning, courtesy of the Healthy Diets Coalition. So we did pick up a number of issues of which we felt in Zimbabwe we could, in terms of policy, improve on. I think the first thing is food environments in public institutions. We feel there is a lot of harmful commercial practices that is taking place. So we need to protect our public institutions, especially in terms of the environment, the food environments. And currently we have school guidelines, school nutrition guidelines, which have been established. And we're really trying to institutionalize those and really ensure that there is very minimal exposure to children to ultra-processed foods, of which this is contributing to the rising cases of overweight and obesity. So we really are looking towards improving food environments for public institutions and especially schools. We also want to build on monitoring compliance within also this, within the food system from the farm to the fork. There's need for strong monitoring for compliance. I think in Brazil, we actually learned that especially in the schools, they get organically grown foods for the children. So there's need for strong monitoring of our food. So this then looks at the comprehensive review and update of the legislation on food legislation, so that we are more equipped in terms of monitoring the whole food system chain from the farm to the fork. And the good thing, we are revising our food and nutrition strategy this year, because we are going into our second year for the national blueprint. And we hope these issues will be highlighted more with the learnings that we're getting from different stakeholders in terms of how we can improve diets, especially in Zimbabwe. So we are hoping the review of the national nutrition strategy will incorporate issues on diets. Then the other thing I've seen that we need consumer awareness. We need to improve on consumer awareness, providing access to nutrition and nutritious and healthy options. We know that the most convenient are the bed food. So we need to have the substitutes, and that's where science comes in. We need more innovations on healthier options, especially in snacks for households. You know, the unhealthy are always available. So science needs to come in and provide those healthy snacks that are convenient for households. So we see that's the role of science. What we have seen also in Zimbabwe, we're building on syntax. There's been some taxes to service providers on fast foods, and this is trying to raise some funds, and we hope those funds go into preventing and creating awareness on how we can improve in terms of diets. We are also seeing, we would also want to build on providing incentives and subsidies to those that are promoting healthy diets, especially farmers and industry, so that at least there's promotion of healthy diets. So in terms of policy, I think those are the things that we need to work on. And continuing on the role of science, we are collecting a lot of data, and we feel we need to continually invest in this data and break it up and simplify it for decision makers. Because as science, if it's not broken down and translated for decision makers to make actionable policies and strategies, it remains a stranger. So we really would want to translate our findings, our global findings, our local findings, so that as our decision makers are provided this information, it's sensible and it can be actionable. Thank you.
Thanks so much, Yvonne. First of all, like this sort of myriad of examples, which just I think again demonstrates that Zimbabwe is taking not just a whole of government, but also that full sort of integration of the role that every stakeholder group, every actor group has to play in actually really making that step change on our food systems transformation, this healthy, sustainable, and just diet thinking. You talked really clearly about the role of consumers, consumer awareness, education, what that means in terms of what happens in schools, ultra-processed food, and you talked multiple times in different ways of that processing and that healthy food, innovative option idea. And again, just as Faiz did, I think you also talked a lot to the issue of data metrics, monitoring, and dashboards, and how both science and government has a real role to play together and putting that in place, and actually the translation piece. A lot of questions on the Q&A about how do we actually translate science into action, particularly for policymakers. And thank you for being so articulate about what that could actually look like, and your call out to the science community to actually be more accessible in terms of what they actually are handing over to policymakers, because at the moment there seems to be a bit of a gap between what science says and then what policymakers actually might be able to see as their hooks. I'm going to quickly though go over to Savio. Savio, the pressure is always on Brazil right now because we are putting you up there as the big leaders. I mean, that's a great place to be in. I think one of the questions that's come up so much would be great to hear from you, not only where are you making progress and how can you actually then increase that progress, but what are some of the big challenges that Brazil is really facing, and how do you think that from a policy perspective you're going to be able to address those? And again, that question is, does science actually have a role to play in that? Again, so I'm giving you still the 3.5 minutes, so we have time to get back to Matthews afterwards.
Sure. Thank you, Amanda. It's a pleasure to be here. Thanks for this invitation. And it's good to see familiar faces here, especially my friends from Africa and Asia that participate together last month here in Brazil of a beautiful study visit promoted by United Nations Nutrition. Brazil, I can say that is proud to be an active and engaged member of the Health Diets for Sustainable Food Systems Coalition. Well, let me begin with science, the role of science, I think. In Brazil, our public policies are designed based on scientific evidence and in close collaboration with research. We have a lot of examples here. The first one, for example, I can mention is the dietary guidelines for the Brazilian population, published in 2014 by our Ministry of Health here in Brazil. It is an important example of how scientific evidence combined with cultural and social understanding, of course, can become a policy instrument that empowers both people and governments. It translates food, nutrition, and sustainability science into practical guidance, emphasizing fresh and minimally processed food, local and traditional diets, and the social act of eating. That's very important, while discouraging the consumption of ultra-processed products. 10 years later, and building on the concepts of ultra-processed foods introduced by the guidelines, we have another example now. We took a very important step with the decree number 11936 last year, issued under the 2023 Constitutional Amendment on Tax Reforms. This law defines the composition of the basic food basket within the scope of Brazil's National Food and Nutrition Security Policy and the National Food Supply Policy. Under this reform, basic food basket items are tax exempt, while unhealthy ultra-processed products face higher health-selective taxes. The basket prioritizes fresh and minimally processed foods such as rice, milk, fruits, and vegetables, eligible for 0 or reduced rates, while sugar-sweetened beverages incur high taxes. These measures, effective from 2026, promote healthier diets and uphold the human right to adequate foods. Beyond the enormous importance of having a Brazilian basic food basket free of ultra-processed products, we now have a law that affirms this concept, which is fundamental for its constant implementation across public policies. Well, I will stop here, and I would put a lot of examples, but you have a debate and you have a time. Thank you.
Xavier, thank you so much. And again, I'm just going to sort of make the links, absolutely what Yvonne was talking about as well, talking about incentives and subsidies, and the very idea of actually having those financial reforms that actually make some foods exempt and actually highly taxes others is a particular innovation in Brazil. Whereas, and I know I'm not meant to say this, but the syntax measures, the sugar-sweetened beverages and others that are happening in a range of different countries have not yet made those connections that you're talking about. So I think, again, we're looking at something, the innovations, and I think all of you have been talking about innovations at all levels, innovations in terms of types of food, farming practices, agroecological farming practices, innovations in terms of financing, innovations in terms of policy. These seem to be coming together. This is my chance, Matthew, to say hi. Really good to see you. And actually now turn into being able to build on that. You know, again, in Zambia, you are faced with different challenges to all the other countries here on the panel today, and yet still with determination to make progress on healthy, sustainable, and just diets. Tell us a little bit about how you think you can accelerate that more. And again, knowing where you sit in Southern Africa, what does that mean in terms of the role of science and evidence in actually being able to actually help you do that? Over to you, Matthews.
Thank you very much, Amanda. Good afternoon. It's afternoon where I am. So indeed, science is very important to the work that we do. We conduct a lot of surveys, we conduct a lot of research just to inform our programming and how we move forward. So a good example is Zambia had to suspend our food fortification efforts until we had conducted a food consumption and micronutrient status survey to understand the dynamics and what kind of support that our communities really needed for us to deal with micronutrient challenges. But of course, I think we have quite a number of tools that we're using. We have the food-based dietary guidelines, just like a number of countries. We equally have the NIPIN platform that has also been helping us to get all those data and use them to translate into policy recommendations and information that the policymakers would want to receive. But of course, I think for me, I wanted to start by just indicating that legislature in Zambia helps us because we enacted the National Food and Nutrition Act number 3 of 2020. So with this act, it has helped us to place all food and nutrition coordination in the Vice President's office. Food and nutrition is a political issue. So the more you get it, in the political spaces, it helps to direct, where government spending or just the direction that the governments would want to take. But for us also, we've also, with this particular piece of legislature, we have coordination structures in place. So from national to sub-national level, so that whatever we're trying to do in one part of the country can also be done in another part of the country. Context matters, the challenge they might face might be different, but having those coordination structures are very helpful. I wanted to talk about the National Nutrition Coordinating Committee of the structures that we have in coordinating, because for us, it's a very powerful tool that helps us each time we get, scientific evidence that is compelling. This particular platform helps us to translate that into policy actions, and instructions are given to government departments and different layers of administration within the country. Just a good example is we came back from the Nutrition for Growth Summit in Paris. And of course, the commitments that Zambia made, one of them was to reduce stunting from 32% to 15%. So already that's a huge target. It's a big dream. But having such a platform helped us to bring, the whole government system to these commitments that have been made. And of course, directives being given to all ministries to find activities that they have to do to ensure that Zambia, meets the commitments that they have made for Nutrition for Growth. And of course, just going into 2026, our national budget is reflective of the instructions and the actions that will help us to reduce stunting, from the current 32% to 15%. Different government ministries, including ministries that, the nutrition space might not, the food and nutrition space might not talk about, more like the ministries of infrastructure and transport, because they don't really play that front role in food and nutrition discussions. But they're really key. If at all food is going to move, in the case of the Ministry of Transport, from places where we've struggled to produce food to places where there's enough food. We're getting food from surplus to places that are having difficulties. All these government directives, and having such a platform becomes quite key. Countries that might not have similar platforms would take long to see that translation of evidence into policy. But for us as a country, each time we have compelling evidence, we conduct our analysis, our surveys, this platform gives directives immediately, and reports are given to the higher offices, such as the Office of the Vice President and other platforms. So otherwise, I think for us as Zambia, evidence is really key. We cannot move or do any actions without evidence. Understanding that also our local and indigenous foods have to, inform the bulk purchases, government purchases in the school feeding programs and other areas as well would help us to ensure that, we have healthy diets reaching the intended target audiences. But quite a number of examples that Zambia has. So, but for now, I think I can end it here and still accommodate some questions. Thank you.
Matthew, thank you so much for that. And again, what we're hearing is a sort of quite consistency of message across all of you, the importance of legislation, being able to say food and nutrition, these are political issues. It needs the highest level of government to be able to show leadership on this. And I'm just thinking, Yvonne, you're sitting in the president's office. Matthews is talking about how this is now centered around the VP's office as well. And I can see that across the world right now. We know that the drive for school meals is coming from the top of government as well, in terms of where public procurement plays that pivotal role, that transformative role. So thank you so much for that. I'm looking at the time. I'm getting into a lot of trouble. Nobody wants to know how much trouble I'm getting into on the timing that we've done today. We've got a short 10 minutes left. I want to make sure that we have time for Lena to do a quick wrap up at the end. We have managed to wrap in quite a lot of the questions on the Q&A. A lot of the questions also everybody gets to hear them. A lot of them are about the how. How do we actually translate the science into policy action? I think a lot of you on the panel, you've talked to it. I said that you would have a minute, but I'm actually only going to give you 30 seconds. So here's a big challenge to each of you to talk to that one priority action or innovation from your experience that we're going to allow us to have the step change that we're all looking for to get to those healthy, sustainable, just diets with the sort of urgency that Fabrice showed us the evidence at the beginning that we actually have to work on. This is not about iterative, incremental change at this point. It needs to be transformative. The EAT-Lancet Commission talks to what transformative looks like, how that happens, what is the one action, policy or innovation that you think we need to be taking. I know that Dr. Sisse has not been able to stay with us, so I'm going to go straight to fires on this. You've got 30 seconds. I'm going to be timing this on my clock at this point.
Thank you so much on this. So very quickly, my point is that, as you mentioned, that science, data, evidence, this is exactly what we believe, that science, data, and evidence, this drives policy, policy drives actions, and actions, in fact, drives impacts. So considering this, I would relate our recent study trip to Brazil. And when we heard and when we saw their CONSIA, a wonderful model, and that has given us so many thoughts to take from there and implement in country, like in Pakistan. So our first next step, what we have started after having our learnings, is establishing our provincial healthy diet resource center to guide our work based upon the data evidence, using and driving our policy work, and also helping the actions. So this is how we would moving forward to the next stage. Thank you so much.
Right, thank you. Thank you for sticking to time, which is absolutely impressive. Yvonne.
For Zimbabwe, I think it would be on behavior change. And one innovation we want to ride on is working with lead mothers, the care group model, and working with Ministry of Health to ensure that the children in the first 1,000 days, they get a complementary diet composed of locally available foods that are not processed. So we catch them young, 1,000 days into early childhood development. So behavior change within those early years of the children through the care group model. Thank you.
Thank you, Yvonne. So to the point and so clear about the one big one that you're wanting to talk to. Savio, go for it.
Sure, thank you, Amanda. I believe that Brazil's experience shows that transformation is possible when we have three components converge: public policy, scientific evidence, and social mobilization. So Brazil now, I think, because of that, is advancing a comprehensive agenda that connects food system transformation, climate action, and social protection.
Okay. Savi, you're really talking to me when you talk to that, is what I talk about, the Feed Care Protect nexus, and that is something that brings this together as well. And to actually, how much can we then continue to accelerate that action so that we're looking across the nexus all the time? It's not one or the other. Matthews, I'm going to come back to you as the last piece. And again, I know you already talked to nutrition for information platforms as well. Again, a big call out to the platforms, as many of you have done, is absolutely essential. Fabrice, we might come back to you as well for you get your 30 seconds. That's a good idea, turning your camera on for me to remember that. Matthews, go ahead.
Thank you very much. So I think for me, two things. First of all, we need to ensure that, the scientific evidence is, messaged in a way that policymakers would understand. So sometimes I think there's this situation where we really present the scientific information in a very scientific way that policymakers would fail to utilize that, good information that would help to improve the situation for the countries. And then maybe lastly, for me, I think everybody has been talking about Brazil. The bigger lesson from Brazil is in our efforts to deal with undernutrition, we often overlook, the other side, the overweight and obesity. If we don't really put safeguards or have some, elements that will help us to arrest any further, negative effects that would come, and this time around, overweight and obesity, it might become another crisis that countries would start now fighting to arrest. Thank you very much.
Matthews, thank you so much. And it's a perfect segue to move over to Fabrice. Fabrice, you're going to get as well 30 seconds of that one. We're not talking about science at this point. We're talking about what is that one innovation action, policy action that you think coming through the 2025 EAT-Lancet Commission is actually going to make that step change that we're looking for.
Well, I mean, I think going back to Lynette's introduction, you look at your national food-based dietary guidelines and recognize that these aren't just important to guide consumption behavior, but that they actually are a recipe for your agricultural agenda and for our trade agenda. If we were to align agriculture and trade to your own national food-based dietary guidelines, this would be a major step change already in driving us towards health, sustainability, and justice. I'll mention very quickly, Amanda, that Mr. Matthews' point on translating science and policy, this is very much what we're trying to do with our summary for and with policymakers that we'll be releasing next in October. And I think for the first time, really have a summary that was co-written by both our scientists and many of you who are working with your national governments. So quite excited about that process.
Thank you, Fabrice. And again, I'd like to actually say thank you to the people here on the panel who have themselves actually contributed directly to that summary for and with policymakers. Again, this attempt to do something a little bit different where science and policy anchored in your country examples actually brings life to possible, plausible, actionable solutions. On that note, huge thank you to all the panelists today. That has been absolutely tremendous. If I could do I will do my little shout out and wave and clap and applause to all of you, and then hand straight back to Lena to actually wrap us up in the last couple of minutes. Lena, over to you.
Thank you so much, Amanda, and to all the panelists for this really interesting exchange and for sharing your experiences at the country level. And a big congratulations to you, Amanda, for the successful managing of the time, which is really not easy to do. When I met Fabrice in Stockholm and I was speaking at a panel there, you asked the question to me, do we need more scientific reports? And I said that One thing that we really need to work on is how we bring the science to society and how we translate it into effective country action. And I think that the conversations we have had here and this webinar serves that kind of purpose. I think that everybody that has participated today will leave with a greater understanding of science, but also new ideas of how this could be applied to their particular contexts and realities, and be able to successfully integrate science into food systems transformation. And this was a message that also came out very strongly at the UNFSS +4 in Addis Ababa this summer. So I want to thank everybody for attending here from the EAT-Lancet Committee, Amanda from Convene, colleagues from FAO, and of course our representatives from the different countries. We will continue organizing these webinars. The next one will be on the 19th of November, looking at leveraging the Rio Conventions for sustainable food systems transformation. So I truly hope you'll be able to join us also on that occasion. All the best to you, and we will continue speaking soon.